I believe safety in general should be part of the government process anyway. But if it's not already, safety measures such as who drops off the children, what time they are dropped off, who hands off to who, those are things that now more than ever should be looked into with more attention than before. In terms of COVID-19 specific measures, and those include face covering, social distancing, hand washing, hand sanitizers. And in addition to that, I believe government should also have in place a tracing mechanism. They should know or have at least standard operating procedures on when they have a case, what to do with it, how do they follow up to make sure that the index case and the contacts are all isolated for at least 10 days to prevent contamination or spread of the disease.
In your experience with work related to human behavior, do you worry that children are being impacted deeply because of the lack of interactions, because of social distancing measures and so forth, and what their future will look like, and what can be done to mitigate such things?
Yes, the lockdown and the reduced social interaction created by COVID has caused mental challenges to all of us. But children and teenagers has had especially a rough time coping emotionally. I believe first and foremost, parents and guardians need to know how to talk to the children, do frequent check-in with the children. The second things that can be done also is to recognize the signs of stress. You'll see different behavior from different children, but there's some common stress signs that can be recognized easily. Those are change in behavior, change in mood. For the toddler, the little ones, they can regress to previous behavior, such as if they were already potty trained, they can go back to wetting themselves. If you recognize those signs of stress, you can organize for the child to be supported in terms of more social interaction with everybody that is around. But if it goes to more stressful behavior such as depression or even a lot of anxiety, pediatrician or even doctors can be there to provide additional support.
Awesome. You also mentioned nutrition, which is very important in environments where food is scarce and food is very expensive. What is your advice to parents in what they can do to try to strengthen their children's immune system as they go back into schools in order for them to fight diseases and, of course, COVID?
As we know, for a strong and resilient immune system to develop, uh, there's more than just food availability that is needed. Parent and guardian will need to have basic knowledge about optimal nutrition, the food or meal prep that will give the children all the ingredients that they need, all the nutrients that they need for their immune system to be strong. So in this case, quality matters a lot rather than quantity. Something else that can be done in terms of nutrition, if we look at countrywide or government-wide, it'll be important for governments to have demographic data about the families that need their support. Where are the poor families located? How much do they have even before the pandemic? And last but not least, physical activity, social interactions, those should be maintained throughout this time to boost the child's immune system and health in general.